understand this diagram, and for the same reason they are not able to draw and label the diagram properly. Today we'll try to study and understand how this diagram we can draw in a simplified manner. Okay, so relation of the first part of the artery. So as we know, first part of the artery is proximal to the pectoralis minor muscle. So anterior to it, which structures will come anterior to it? Anterior to the first part of the axillary artery, first there is skin, then there is a layer of superficial fascia. We can draw superficial fascia here. Okay. Within the superficial fascia, you will find a layer of muscle, that is the platysma muscle, and three cutaneous nerves. Okay. We will draw this cutaneous nerves with this color. 1, 2, and 3. These are the supraclavicular nerves, medial, intermediate, and lateral supraclavicular nerve. Okay. So the first there is skin, first layer, then there is superficial fascia. Within the superficial fascia there is platysma muscle and three cutaneous nerves, medial, intermediate, and lateral supraclavicular nerve. After this there is a layer of deep fascia. So consider this as the deep fascia. Deep to the deep fascia there is pectoralis major muscle. Okay, so we'll consider this as the pectoralis major muscle. This is the pectoralis major muscle. Okay, let me pectoralis major. Okay, now let's see the relation of the arteries. First, we'll draw the artery. This is the axillary artery. As we are all aware, medial to the artery there is axillary vein. So this is the axillary vein. First part of the axillary artery is covered by skin, superficial fascia, pectoralis major muscle, and very important layer of fascia that is known as clavipectoral fascia. So this is the clavipectoral fascia. Okay. Now, what are the relation of the cords of brachial plexus around the first part of the axillary artery? So as we know, the medial cord of the brachial plexus lies posterior to the artery, and the posterior cord and lateral cord, they lie lateral to it. So this is the medial cord of brachial plexus, this is the posterior cord, and this is the lateral cord of brachial plexus. At this level, there are two nerves. From the lateral cord, there is lateral pectoral nerve. From the medial cord, there is medial pectoral nerve. And there is a loop of communication between the medial and lateral pectoral nerve at this level. Okay, so skin, superficial fascia, deep fascia, pectoralis major muscle, clavipectoral fascia. These are the anterior relation. Medial to the artery, there is axillary vein. Behind the artery, medial cord of brachial plexus, lateral to the artery, posterior and lateral cord of brachial plexus, and this relation, this is the medial pectoral nerve, lateral pectoral nerve, and this is the loop of communication between the medial and lateral pectoral nerve around the first part of the axillary artery. This is the first part of the axillary artery. Now what is behind the artery? So as we know, first part of the artery is just beyond the outer border of the first rib. So it essentially rests on the upper two digitation of the serratus anterior muscle. So we can draw here serratus anterior muscle. On the surface of the serratus anterior muscle, there is a nerve, that is the long thoracic nerve, and deep to serratus anterior, you will find first and second rib and the intercostal space between them. So we can simply consider first intercostal space and consider this muscle as the serratus anterior muscle. So these are the relations of the first part of the axillary artery. Now here we can draw this lateral pectoral nerve piercing the clavipectoral fascia. One branch from the axillary artery, that is the thoracoacromial artery, piercing the cloipectoral fascia, and cephalic vein. Let me draw with blue. Okay, cephalic vein. So this is cephalic vein. Artery is the thoracoacromial artery. Nerve is the lateral pectoral nerve. Relation of the second part of the axillary artery. So first there is skin. Deep to the skin, there is a layer of superficial fascia. Further deep to it, there is deep fascia. This is the deep fascia. And second part is related to two muscle. In the superficial plane, there is pectoralis major muscle. Consider this as pectoralis major muscle. And in the deeper plane, it is related to pectoralis minor muscle. These are the anterior relations. Skin, superficial fascia, deep fascia, pectoralis major, and pectoralis minor muscle. Now artery, this is the artery, second part of the artery. Medial to the artery, there is axillary vein. This is the vein and the artery. All three cords of brachial plexus, they are arranged according to their names around the second part of the axillary artery. So medial cord is medial to it, posterior cord lies posterior to it, and the lateral cord lies lateral to it. Along with the medial cord, second part is also related to the medial pectoral nerve. Now behind the axillary artery, now there is only one muscle, for that is the muscle forming the posterior wall of the axilla, and that is the subscapularis muscle. So you can consider this muscle as the subscapularis. Laterally, lateral to it lies the coracobrachialis muscle and short head of the bicep. These are the muscles supplementing the lateral wall of the axilla. So these are the relations of the second part of the axillary artery. Relation of the third part of the axillary artery. So first there is skin. Deep to the skin, there is a layer of superficial fascia or subcutaneous tissue. Deep to it, there is a layer of deep fascia is here. So this is the deep fascia, and muscle, that is the pectoralis major muscle. Consider this as the pectoralis major muscle. This is the pectoralis major muscle. Skin, superficial fascia, deep fascia, and the pectoralis major muscle. These are the anterior relation. Now artery. So this is the third part of the axillary artery. Medial to it lies the axillary vein. This is the vein. This is the artery. Now third part of the axillary artery is now related to the branches arising from the three cords of brachial plexus. First and second part, they are related to the cords, and third part is related to the branches arising from this cord. So branches arising from the lateral cord, there is musculocutaneous nerve is here, and the larger one will be the lateral root of the median nerve. So this is the musculocutaneous nerve, and this is the lateral root of the median nerve. From the posterior cord, there will be radial nerve, and lateral to it axillary nerve. Radial nerve and axillary nerve. From the medial cord, in the superficial plane between the artery and vein, there is medial cutaneous nerve of forearm. In the deeper plane, there is ulnar nerve, and medial to the axillary vein, there is medial cutaneous nerve of the arm. Medial cord also gives medial root of the median nerve, which crosses the third part of the axillary artery. So we can draw this as it is obliquely crossing the artery. In a section, it will appear like this. So this is the medial root of the median nerve. This is the lateral root of the median nerve. Okay. Now laterally there is coracobrachialis muscle and short head of the biceps femoris muscle. Posteriorly there is subscapularis muscle. In the upper part there is only subscapularis muscle related posteriorly. So posteriorly the artery rests on the subscapularis muscle separated by radial nerve and the axillary nerve. Let's quickly label all this. So medially this is the ulnar nerve, this is the medial cutaneous nerve of forearm, this is medial cutaneous nerve of arm. Posteriorly this is the radial nerve, this is axillary nerve. Because the small branch is actually the musculocutaneous nerve, and this is the lateral root of the median nerve. This is medial root of the median nerve. Lateral root of the median nerve and the medial root of the median nerve. This is coracobrachialis. This is short head of the bicep, and this is subscapularis. Now third part of the axillary artery, most distal part, it will be related to skin, superficial fascia and deep fascia only. Most lowest part, the most distal part of the axillary artery is not covered by pectoralis major muscle. So this is the artery, medial to it this is the vein. Anteriorly there will be skin, superficial fascia and deep fascia only. Posterior relation will also change. Posteriorly now it will have two muscle. One is the latissimus dorsi and deep to it there is teres major muscle. Subscapularis is in the upper part, but in the lower part there is latissimus dorsi and teres major muscle. What about the nerves related to it? So now it will be related directly to the medial cutaneous nerve of forearm, ulnar nerve, medial cutaneous nerve of the arm. These are the branches from the medial cord. From the posterior cord, now it will be related only to the radial nerve, and laterally it will be related to the trunk of the median nerve. Further laterally, there is coracobrachialis and short head of the bicep. Two muscles here, coracobrachialis and short head of the biceps. So these are the relation of the most distal part. Okay, skin, superficial fascia, deep fascia. This is the artery, latissimus dorsi, teres major posteriorly. This is the medial cutaneous nerve of forearm, medial cutaneous nerve of arm. This is the ulnar nerve, radial nerve, trunk of the median nerve, coracobrachialis, short head of the bicep.